Hi, I'm Dr. Shikha Sharma and you're watching Vedic Wellness. And today I'm going to be explaining about insulin resistance. So firstly, insulin resistance is very common today in society, and India may almost become the diabetic capital of the world because there's so many people who have insulin resistance and even diabetes. So what is insulin? Insulin is a hormone which helps your cells, the cells in your muscles, fat and other tissues to actually absorb glucose, which is important for its own metabolism. So it is a food for the cells. And insulin resistance happens when the cells, even if they're hungry, they don't allow insulin to transport this glucose or the food into the cells. Now, why do you think that would happen? That would happen because of multiple reasons, because of the kind of diet you are having, the kind of fatty food you are having, the kind of trans fat food you are having. And fundamentally, it's called an inflammatory reaction in the body. But before I go there, I want to explain that what are the signs of insulin resistance. The first thing is that there is abdominal obesity, which means that in women more than 35 inches of waist and in men more than 40 inches of waist means that they are highly likely to have insulin resistance and be pre-diabetic. The second thing is, if the blood sugar fasting is more than 100, then definitely it's heading towards insulin resistance and pre-diabetes. Then if the good cholesterol, which is HDL cholesterol, is which should be actually 50 in women and 40 in men, if it is not that much, if it's lesser, that means your good cholesterol is less than normal, which is 50 in women and 40 in men. If the triglycerides, so what is triglycerides? Tri meaning 3, glycerol meaning sugar molecules. The triglycerides, if it goes above 150, that means there is a lot of glucose in your body. There's a lot of what we call in layman terms sugar. It's not really sugar, it's glucose in your body. So your triglycerides are going up. And in many cases, you will also find that their blood pressure starts going up, which is normal. If it's going beyond normal, like suppose if it's 130, 80 and beyond, which means that they are heading for insulin resistance or they're already insulin resistant. In some people, they can even feel skin tags. These are small sort of rough surface on the skin, which you can feel on your skin. It's not very visible, but you can feel it. Now, if all these things are happening, that means you have become insulin resistant, which means that your obesity and is leading towards a diabetic condition also. And the good news is this is the right time to take action. And what action you should take, I'll be speaking about in the next video. But a couple of things more in insulin resistance. The first thing is that if you have a genetic history in your family of diabetes, then you should be even more careful. Second thing is, if you've had surgeries in which you have a lot of sugar drips have been given, then you have to knock off that weight after surgeries. I've seen particularly in women after surgeries, after cesareans, they tend to keep that weight because they already are a little resistant. The third thing which is very important is if polycystic ovary is there in your family, then you need to again make sure that your insulin resistance is treated very quickly. And there are natural methods of doing it, which I'll be discussing in the next video. If you have questions, you can leave a query on our website. In fact, you can join our community. वहाँ पे आपके सारे सवालों का एब्सोल्युटली फ्री जवाब मिलेगा. हमारी पूरी टीम है डॉक्टर्स की, न्यूट्रिशनिस्ट यानी डाइटिशियंस की, और वो आपको आपके सवालों का जवाब देंगे.